Good afternoon. This is, this is Audrey Russo. Welcome to our 9th week of business as usual. I'm pretty thrilled about today. We have been doing this for 9 weeks, and today we have an opportunity to speak with Andy Carter, and he is the president and CEO of the Hospital Health System Association of Pennsylvania. Now, before we get started, I have a couple of things that I just want to get out of the way so everyone can understand. We have, first of all, I want to give a shout out to Huntington Bank and to AT&T, who have been partners with us for this entire journey. And we see no end in sight at this point. We've gotten a lot of great feedback in terms of the engagement and the kinds of guests that we have. So I thank them both. I do want to just remind everyone that we have a packed week already. Tomorrow we are hosting Jeff Broadhurst, President and CEO of Eaton Park Hospitality Group. And then we have on Wednesday, the Global Chief Information Officer at Zoom, which many of us have been using all the time. Thursday, we have Patrick McKenna from One America Works, who will discuss a new paradigm for attracting technology businesses to cities like Pittsburgh. And then we wrap up the week Friday with Rich Lunak, President and CEO of Innovation Works. And they were just recently provided with additional state capital to help local startups. So just a little bit about the technology. We've muted all of you, and we've muted you on purpose because there's way too much noise in everyone's background. We really appreciate that. But with that said, we want it to be interactive. We have a chat that's at the bottom of your screen, and that will allow you to ask questions. Hopefully we'll have a chance to answer those questions based on, the information that is being conveyed today. We also are asking that please do not use this as a sales tool, and let us know, this is just for chat and for information. So I want to jump in, and I'd like to bring on today's guest, Andy Carter, President and CEO of the Hospital and Health System Association of Pennsylvania. Andy, welcome.
Audrey, thanks so much for having me.
No, very happy to have you. Very timely, very important, given everything that's going on and the rapid movement of information and news. This is really critical to all of us. So can you start by just describing the type of members so people understand your association, how you represent them, and give a status report on, how they're faring in the various regions across the Commonwealth?
Great. Well, thank you, Audrey. HAP represents over 240 general acute care hospitals, children's hospitals, rehabilitation hospitals, surgery hospitals, and the like. And many of our organizations are very large integrated delivery systems that also provide nursing home care, home health care, lots of outpatient care. Pretty much HAP pays attention to virtually the whole healthcare delivery system. To your question, how are they faring? I'd say it varies widely across the state. In Southeast Pennsylvania, they actually have the greatest number of COVID cases and the greatest number of inpatient hospitalizations, followed closely by the Northeast. So in those two parts of the Commonwealth, they are suffering the double hit of both lots of COVID patients as well as the financial hit that is happening across the entire Commonwealth, including in Western Pennsylvania, where there are far, far fewer cases. However, whether you have a lot of COVID patients or not, you have suspended your elective and scheduled procedures and surgeries, and you've done so since about mid-March. And as a consequence, the major driver of revenue has essentially disappeared for all these facilities. And we're in the slow process now of gearing back up to try to return to normal operations as healthcare providers, but it's going to be a very long journey. And so it's not just the financial harm to these organizations that are on our mind. It's also that clearly by suspending all this healthcare, important healthcare isn't getting provided. And that means people who need to get surgeries, just because they could be scheduled, doesn't mean they're elective. It just means they're not emergent. But somebody with a hernia, for example, or someone who is in should be regularly screened for cancer. Those are services that are not being provided. And so that's bad for the future health of Pennsylvanians.
I mean, it's about sentiment and confidence, right? And when that confidence starts to erode, we start to see that in many, many facets. But for patients that actually have faced delays in treating serious health problems, either because of the shutdown order or just as much based on their own fears, as I've mentioned, you know, how are hospitals going to ensure that people are treated and that there's safety, and just to convince everyone that it's okay to have a hernia, it's okay, you know, repaired, it's okay to have your hip replaced?
It's going to be a process. So let's start first with getting your hospital ready to resume these scheduled procedures again. You have to be sure of a number of things are in place, that you have plenty of so-called personal protective equipment on hand, not only to take care of these new patients, but to have an adequate supply at hand in case there is a resurgence of cases, of COVID-19 cases. You have to make sure that your staff are ready to go and that you've restored your staffing complement of clinicians, schedulers, billers, everybody, that you've brought back so that you can resume operations.
Mm-hmm.
And then most importantly, you have to make sure that you've set up protocols so that non-COVID-19 patients who present to get a procedure done can go walk through the facility safely and not be exposed to the virus. And how are you going to do that? Well, you're going to make sure that all the incoming patients are wearing masks. In many cases, hospitals will decide to make sure that they have taken a COVID-19 test before they come to the hospital. They'll make sure that all the employees are wearing appropriate protective gear and masks and gloves to create a COVID-19 free environment, because we don't want to expose any patient to COVID-19, and we don't want to bring new COVID-19 patients in for routine care unwittingly and exposing anyone to their infection. So you get that in order, and then you begin communicating to patients. As soon as you're ready, and the Secretary of Health issued guidelines to help hospitals determine when they are ready to resume these procedures, you start calling patients and you reassure them that all the safety steps that should be taken have been taken and are in place, and that your physician or advanced practice professional is ready and to protect your safety while also providing you the care you need. It's going to take a good long while before people believe that to be true.
Right.
So we just have to keep talking to them and be available to answer their questions. And no question is too small. Every question is fair. And we just want that dialogue to begin so that patients won't put off needed care any longer than necessary.
So do you think that, is there a sense or a belief or a hypothesis that perhaps emergency room care will increase as people put off and defer some of the elective surgeries, that really that term elective is probably a little deceiving?
I agree, it is deceiving. I don't know that the data yet supports that emergency department visits are increasing because of care that was deferred too long, but it's the kind of data that hospitals are going to be watching for sure. What we have seen, and this has been widely reported in the general press, we have seen evidence of reductions in people presenting who have cardiac issues, which is, surprising, because there's no reason to believe that the need for urgent cardiac care has diminished as a result of COVID-19. And so the hospitals and physician community are trying to figure out, why have we seen a reduction in this urgently needed care? What's happening to some of these patients? We're not entirely sure.
Well, I failed to mention when I kicked off that I'm joined by Jonathan Kersting. He's Vice President of Visibility, and he manages the questions and statements And Jonathan, is there a statement that's on the chat?
There is. I'm really happy to hear that this has been reported out. So this is from Don Group, and he said he just recently had a procedure at UPMC St. Margaret's, and they had a very secure system in place. He said they had a COVID-19 screening 3 days prior, never had a concern about being exposed. All the nursing staff had the proper PPE. Said he'd actually go back for another procedure tomorrow. Must have been pretty fun. I wouldn't want to go back.
Well, that's exactly what we're going to see unfold over time. UPMC clearly and I has taken all the steps, and you just heard testimony that that's true. Some hospitals aren't there yet, particularly in Southeast PA. I think we're going to see a much slower ramp up to these kinds of procedures. But out where counties have clearly seen a huge drop off on new cases, you're going to see this kind of activity ratcheting up relatively more quickly. But still, it's going to take a while for that kind of testimony to spread and for people to feel equally confident.
So let's shift and talk about rural, because rural hospitals have been facing a huge uphill battle before the pandemic occurred. So what trends do you see accelerating as it relates to providing services to rural Pennsylvanians? I mean, I know we've made some progress with telemedicine, but what else?
Yeah, I think we want to preserve a solid, safe healthcare system for rural Pennsylvanians. Telehealth, you just mentioned it, Audrey, hugely important. And we've been talking about telehealth for years and years. And this pandemic, and I refuse to use the metaphor of silver lining just because it's hard to imagine there is a glimmer of hope that telemedicine is going to accelerate in its adoption in two ways. Patient comfort with it, the confidence that many of their healthcare concerns can be addressed using telehealth technology. People are starting to use it. They had no choice but to consult with their practitioner via exactly the kind of medium that we're using now. Secondly, we have seen a huge reduction in red tape and regulatory barriers to telehealth. The Commonwealth has done a terrific job making it easier for providers to offer telehealth and to do so within the regulatory framework. And thirdly, we're also seeing payers recognize the value of telehealth. Now, it's uneven. Some payers are better at paying for telehealth than others. But I think we're going to see a significant reduction in resistance to telehealth. That circles back to supporting rural Pennsylvanians having access to world-class healthcare that can be hundreds of miles away. But within those rural communities, they are going to need actual healthcare. Right. And one of the reasons we're pursuing financial relief for all hospitals and other healthcare providers to make up for the lost revenue is so that they can remain viable organizations even as they transform. To transform to be a good telehealth provider means you have to make sure you have all the equipment, that you have access to broadband services, and that you can still recruit staff within your facility to be able to connect patients with telehealth resources. There are pilot projects already underway that the Commonwealth has teamed up with the federal government to sponsor that help stabilize revenues for rural hospitals in exchange for them transforming to not try to be all things to all people, but to concentrate on a defined set of services that are most important to individual communities. They're coming to terms with the fact that not every hospital can have a full-blown cardiac service. They may have to provide much more limited cardiac care and then transfer patients who need more elaborate care to larger facilities. So they're doing that work now. And this COVID pandemic is accelerating those conversations.
We have another good statement that's out there. Jonathan, do you want to read what Ray wrote?
Yeah, so Ray Huber, a frequenter of our webcast here, says his father-in-law, who is 95, had to go into Shadyside emergency room and stayed there for 8 days. So they were all protected with PPE, and he was separated from the COVID patients. and they all have the proper protocols in place. So I'm feeling like Pittsburgh's on the good side of the curve here of really getting in that prepared mode to become full-blown hospitals treating all types of patients right now, huh?
You know, this is a reminder, word of mouth is going to be a huge driver in the recovery of the healthcare system. If we continue to have these positive reports of good experience, a feeling that you are safely protected from the virus, we'll be able to ratchet up more quickly. So it'll be incumbent upon HAP members, and they know this, to do everything they can to be ready before they take their first non-COVID patients back. Because word of mouth can go the other direction. And so I know they're going to be very, very cautious.
So broadband has been the big barrier in terms of access to telemedicine, while the urban areas have been quicker to adopt it, even though there's been access. So I'm glad that you brought that up and mentioned that that's a critical piece, and that's a critical piece for all of us here that represent the tech community to make sure that we have access. And you know what, we don't in many of those communities. So your advocacy on that is important, and I hope we can partner on that. So we have, so I think there might be another question, Jonathan. You want to do that before I jump into the next question with them?
That magic time of the webcast where everyone's getting their great questions in, Audrey. And so from John Zambelli, he wants to ask, are hospitals getting adequate PPE from the federal government, or are they getting it like on their own?
Well, there's never been enough PPE during this crisis, so it is not adequate across the state. However, it's generally okay. The reason I say it's not adequate, because every healthcare provider wants to have at least a 2-week supply of these resources at hand, because you always want to be ready for the next, terrific crisis, like another train accident, for example, where you have dozens of patients that are brought in. So the good news is that we are not facing the kind of dramatic shortages that lead to harm, the risk of harm to patients. A couple of reasons for that. One is hospitals have mutual aid agreements in which they agree to support each other, that if I have excess supplies, I'm happy to ship them across town or even across the Commonwealth to help meet needs. I have a team of 7 professionals that are posted around the state who help implement those mutual aid agreements. So that kind of collaboration with each other and with the Department of Health and PEMA means that we're really able to address the fact that we don't have enough without creating significant risk to patients, or even, of course, equally important, to our healthcare workers.
So this is something that's sort of near and dear to my heart right now and over the last couple of months. In about a quarter of long-term care facilities, we've seen tremendous suffering and loss of life. In many ways, you could describe these facilities as the most dangerous occupiable square feet in the Commonwealth. And actually, if you go back to Washington State, that's where the first outbreak actually occurred. So the Pennsylvania General Assembly will be moving legislation this week. And we talked about that just moments before we got on the call, to direct $500 and $600, about $1 million to university-based hospital systems to help them provide direct support to nursing homes. How do your members, do they feel about this approach? And do you think this is an important step?
Well, I'll say 2 things. One is that we're still looking at the proposal, but I will say it's based on really fundamentally strong ideas, which include the idea that we work together across the delivery system from acute care to skilled nursing facilities, and we already do. That team of 7 folks that are posted around the Commonwealth that I mentioned already provide on a small scale a great deal of training and support to skilled nursing facilities to help them adapt to the COVID-19 situation. But as you noted, there's a huge problem. And the idea of dramatically expanding that kind of training and support and collaboration is a really sound idea. And it's a vote of confidence in many of my members that are, as I understand the proposal, several large academic affiliated medical centers are envisioned to play a leading role in providing the support to the skilled nursing facility. That's good news. And these large systems are well positioned to help improve infection control practices and to manage supplies and to manage patient care in ways that are appropriate to this kind of pandemic. So the basic idea is a very sound one. We just have to finish reviewing the specifics. I would say the second major part after endorsing the concept is that I endorse the concept in the context of recognizing that we are going to need a number of solutions to be sure that Pennsylvanians, whether they're frail nursing home residents or 35-year-olds who've gotten the virus, the whole system has to be responsive to all Pennsylvanians. So in addition to a strong, well-funded strategy to improve outcomes for nursing home residents, we have to make sure we're investing in hospitals, federally qualified health centers, the physician community, the nursing community, and on and on. It's hugely important that we.
I just think that the statistics of the number of people, and if you look at Beaver, Westmoreland, Allegheny County, the number of people that have actually passed away with the diagnosis of COVID is over 73%, I believe. And maybe even in Beaver County alone, it was like 89%. So it's hard to be dismissive when you're really looking at that data.
Nobody can dismiss the crisis facing our skilled nursing facility community. That's why we're very supportive of efforts to be responsive and to get in there and with necessary resources and training. These are very vulnerable Pennsylvanians, no question about it.
Yeah. When you think the amount of people that are in that age group, particularly like in Allegheny County, it's pretty, it's one of the top 5 in the United States. So I'm going to ask a quick question real quick. Is any estimate of the number of job losses in healthcare? Any employees involved with outpatient procedures?
Those are some of the employees that were in some hospitals clearly furloughed or laid off. I haven't tabulated for Pennsylvania the number of layoffs and furloughs, but we know it's so far in the thousands. In Western Pennsylvania, you've probably tracked now public layoff announcements from several of our members out there, particularly our mid-size independent hospitals have announced layoffs. And in the northeast part of the state, thousands of layoffs have been announced. And then I think there was something in the press today about a nationwide estimate of well over 1 million healthcare workers have been laid off. So it's significant. And I think it's evidence of the stress that the healthcare delivery system is under as a result of COVID-19. And what we want to do is restore the fiscal stability of these hospitals so that they can bring all these workers back and be engines of not just the healthcare delivery recovery, but also the economic recovery. I mean, Pennsylvania's hospitals employ directly and indirectly around 650,000 Pennsylvanians, 1 in 10 workers.
Right.
So extreme financial distress for these hospitals and health systems is definitely a huge risk to workers across the state.
Have you ever seen anything like this in your career?
40 years in healthcare, nothing even close. Nothing close.
Okay.
Nope.
So in terms of your hospital members, in what way are you seeing them deploy new technologies to help address the crisis? Are you seeing that? Like if there's any way that our membership that's across technology could help in any way, and what are the key challenges? And how could we get engaged to be helpful?
Well, that's a wonderful question. We welcome all offers of support, and individual members are definitely taking advantage of the opportunity to relook at everything they do. And on the technology front, we've already talked about telehealth, but that's front and center for almost all the members. But some of our other and larger members, particularly those affiliated with universities, are clearly looking at ways of using, for example, 3D printing for more and more supplies and equipment that they need. There's a great deal of biomedical research that they will want to be exploring, such as new ways to make full use of plasma products to help with recovery for patients. This is a time when thoughtful leaders have no choice but to look at all their processes, internally, their business processes, and see if there's technology out there that allow them to get more done with fewer folks. That's definitely an area of focus for our hospital leaders. Connecting with your members, I think we just keep finding ways to stay in touch, and you all continue, and your members doing all they can to share their technology with healthcare providers. I think you're going to, especially as we get on the other end of this outbreak, you'll never have more receptive potential customers than you will in the coming months.
So we have time for another question. There's a question from Janine, Jonathan.
Yeah.
You could ask that one. There might be some other ones too.
Absolutely. Absolutely. So let me see here. So what are healthcare systems doing to follow COVID patients post-discharge to monitor downstream increased health risk in subsequent health events that are not COVID, but likely a result of having had COVID?
Oh, so.
It's been a high priority for healthcare for 2 decades to build better and better follow-up protocols. One of the technology has helped make that much more reliable. Electronic health records have played a huge role in creating the triggers for healthcare providers to put in place follow-up healthcare, scheduling of follow-up appointments, placing follow-up phone calls just to make sure patients are complying with their medication regime, having them come in for routine checkups post initial care. So it varies widely. Our most sophisticated members have it down pat. Others are probably still working through being sure that they are consistent and reliable in the best follow-up care that they should be providing. I think the recovery is understood at this time to take quite a while. We'll be developing new protocols to make sure that patients are getting the best care for this particular illness as people recover from it. We know they come out of hospital settings, for example. If they were in an ICU, they typically have profound pulmonary challenges ahead of them, lots of rehab and the like. So it's profoundly difficult illness to recover from.
So what do you think in your mind, to wrap this up and to thank you, what do you think the next 6 months look like? We've just finished going through 9 weeks, 10 weeks here in the Commonwealth. What are some of your thoughts about the next, even take the next 10 weeks?
Stepping, it should feel to all of us like stepping gingerly forward into the daylight. Let's not rush into it. We should be cautious. We should continue to follow public health authorities' recommendations for maintaining social distance. As the Commonwealth relaxes current restrictions, we should follow the details of those relaxation instructions. This is a highly, highly contagious illness that is asymptomatic for a huge number of the people who acquire it, which makes it very dangerous when asymptomatic people interact with people who are potentially extremely vulnerable. Healthcare will return to normal, but not quickly. It will take months before we'll feel that the same number of people are coming forward for care that were before the middle of March.
Well, thank you for the time, Andy Carter with HAP. Really appreciate you taking the time with us. These are not easy times. And I think we could wrap up by saying telehealth, broadband, protocols, standards, all those things are probably on top of your list of things to do. And know that in the tech community, we care about this, urban or rural. And we care about our aging population as well as those who are afflicted with COVID. So these are complex times. People are still working from home. And we are taking under the governor's advice that working from home, if you can, you need to, you should, you ought to. And that's how we're behaving. So many of us are very lucky that we can do that. There are many who cannot. Even if they're in tech, they cannot. And so safety and the feeling of sentiment that you can feel, have some confidence is really important. So thank you for your work. Thank you for taking the time with us today. And you have a website. I know if you go out, you want to tell everyone what your website is, and we'll put it next to your archives.
Great. Thanks so much, Audrey. It's haponline.org.
Okay.
Enough.
All right. Well, thank you, everyone. See you here tomorrow, same time, and have a great day.
Thank you.